Imagine a tiny tick bite silently turning into a serious health crisis, especially for those over 60. Here on Elderly Wisdom Secrets, we reveal the hidden dangers of Lyme disease in seniors, an illness that often hides behind common symptoms like fatigue, joint pain, or nerve problems, catching many off guard until it's too late. What if the unexplained aches and exhaustion you've been feeling aren't just aging, but signs of this stealthy invader? In today's video, we'll uncover how Lyme disease uniquely impacts older adults, the early warning signs you mustn't ignore, and powerful steps you can take to protect yourself and your loved ones. Stay tuned, because the knowledge ahead could be the key to preserving your health and independence. Let's start by exploring what Lyme disease really is and why it demands your attention now more than ever. Lyme disease is a sneaky and often misunderstood illness caused by the bite of tiny black-legged ticks, commonly known as deer ticks. These minuscule creatures might seem insignificant, but they carry a bacteria called Borrelia burgdorferi that can stealthily enter your body and trigger a cascade of health issues, especially for seniors. As we grow older, our immune systems naturally weaken, making it harder to fight off infections. This means that older adults are at a higher risk not only of contracting Lyme disease but also of experiencing more severe complications. The ticks thrive in wooded, brushy areas and tall grasses, places many seniors enjoy for hiking, gardening, or simply spending time in nature. I've personally heard from people who dismissed a tick bite as just a minor annoyance, only to face months of unexplained fatigue, joint pain, or nerve issues that deeply impacted their quality of life. The invisible nature of Lyme disease makes it especially dangerous. It can hide behind symptoms that seem like typical aging or other chronic conditions. Understanding where these ticks live, how they transmit the disease, and why seniors are particularly vulnerable is the crucial first step in protecting yourself and your loved ones. Now that we've unraveled the origins of this silent and persistent threat, it's time to recognize the early warning signs you shouldn't ignore, signs that can make all the difference in timely treatment and recovery. One of the most recognizable and important early warning signs of Lyme disease is a skin rash called erythema migrans, which can serve as a mini-alarm for anyone exposed to tick bites. This rash is often described as a bull's eye because it typically starts as a red spot at the bite site and gradually expands outward, sometimes with a clear ring in the middle, resembling a target. However, not everyone develops this rash, and when it does appear, it might be faint or overlooked, especially among seniors whose skin can be less reactive or who may confuse it with other skin conditions. Beyond the rash, Lyme disease often begins with flu-like symptoms such as fever, chills, headaches, and overwhelming fatigue that can last for days or even weeks, making it difficult to distinguish from a common viral infection or simply getting older. What complicates matters further is the intermittent joint pain that many sufferers experience, frequently affecting the knees but sometimes impacting other joints as well. These aches can be sudden and severe, sometimes accompanied by swelling, causing real challenges in mobility and daily tasks. For older adults, this joint pain is often mistaken for arthritis or other chronic conditions, delaying the right diagnosis and treatment. Even more concerning are the neurological symptoms that Lyme disease can cause as it progresses: numbness, tingling, muscle weakness, or cognitive issues like memory lapses and difficulty concentrating. These neurological signs can be subtle at first but progressively worsen, making everyday activities harder and affecting quality of life. From my own conversations with seniors facing Lyme disease, I've heard how frustrating and confusing it can be to deal with these varied symptoms, especially when doctors initially misattribute them to aging or other illnesses. This makes awareness of the broad spectrum of Lyme symptoms essential, particularly for seniors who are more vulnerable to complications. Early recognition and medical intervention can dramatically improve outcomes, preventing long-term damage and helping maintain independence. Now that we have a clear picture of these symptoms, it's time to explore why Lyme disease tends to be more severe in older adults and what that means for prevention and treatment. As we grow older, our bodies naturally become more vulnerable to infections like Lyme disease, and the risks for serious complications increase significantly. One of the key factors behind this heightened vulnerability is the decline of the immune system, which no longer functions with the same strength and precision as it did in younger years. For seniors, this weakened immune response means that the body struggles to identify and fight off the Lyme bacteria early on, allowing the infection to quietly spread deeper and cause more extensive harm. Unlike younger individuals who might experience swift symptoms and seek prompt treatment, many older adults face a delayed immune reaction, which unfortunately makes the disease more severe and complicated to treat. Moreover, many seniors live with chronic health conditions such as diabetes, heart disease, or arthritis. These underlying illnesses not only place additional stress on the body but also mask or mimic the symptoms of Lyme disease, making it a challenge to diagnose correctly and swiftly. For example, joint pain caused by Lyme can be easily mistaken for arthritis flare-ups, while fatigue might be attributed to general aging or other health issues. I've spoken with numerous seniors who shared how their symptoms were initially misunderstood or overlooked, leading to delays in treatment and prolonged suffering. These experiences underscore the importance of awareness and proactive health monitoring in this age group. In addition, older adults may find it harder to notice early signs of Lyme disease due to subtler symptoms or the presence of other ongoing health problems, which can confuse both patients and healthcare providers. This delayed detection often results in more complex complications such as neurological problems, heart inflammation, or severe arthritis, conditions that require longer, more intensive treatments and can greatly impact quality of life. Recognizing these risks is vital for seniors and their families. It's not just about avoiding ticks but understanding that timely prevention, early diagnosis, and attentive medical care are essential to managing Lyme disease effectively in older adults. Now that we understand why seniors are more susceptible to severe complications, let's discuss practical, everyday steps you can take to protect yourself and your loved ones from this stealthy threat. Protecting yourself from Lyme disease may seem overwhelming at first, but adopting a few simple, consistent habits can make a huge difference, especially if you love spending time outdoors surrounded by nature. One of the most effective strategies starts with what you wear. Choosing long-sleeved shirts and pants that cover your skin, preferably in light colors, not only keeps ticks from easily reaching your skin but also makes spotting these tiny parasites much easier before they attach. Many seniors I've talked to say this small change transformed their outdoor experiences, allowing them to enjoy walks or gardening with peace of mind. Beyond clothing, a thorough head-to-toe check after being outside is absolutely essential. Ticks love hiding in less visible places, behind your ears, under your arms, around your waist, and even between your toes. Catching and removing ticks quickly is crucial because the risk of infection increases the longer a tick remains attached. Using fine-tipped tweezers, you can gently pull the tick out without squeezing its body, reducing the chance of bacteria entering your system. In addition to personal checks, using tick repellents or medications approved by healthcare professionals adds a valuable layer of protection. I've known seniors who swear by sprays containing DEET or permethrin-treated clothing to keep ticks at bay, especially during the peak tick season in spring and summer. Keeping your home environment safe is another powerful step. Ticks thrive in tall grass, leaf litter, and brushy areas, so regular yard maintenance, trimming grass, clearing fallen leaves, and creating a tick-safe zone around your house helps reduce their presence. Even simple actions like placing a barrier of wood chips or gravel between your lawn and wooded areas can discourage ticks from migrating into spaces where you spend time. Together, these preventive measures form a strong defense against Lyme disease. They empower you to enjoy nature while minimizing risks. A balance I believe is vital for maintaining both physical and mental well-being as we age. Now that we've explored how to guard yourself against this stealthy threat, let's dive into the best treatment options available if Lyme disease does strike, and why catching it early can make all the difference in your recovery. Treating Lyme disease effectively hinges on one crucial factor: catching it early. When detected in its initial stages, Lyme disease is typically treated successfully with a course of antibiotics, often taken orally. These medications work to eliminate the bacteria before it has a chance to cause lasting harm. From the stories I've gathered, many seniors who recognized the symptoms early and began treatment promptly were able to avoid the severe joint pain, fatigue, and neurological issues that can develop if the disease is left unchecked. The relief they experienced after completing their antibiotic regimen was life-changing, regaining mobility, energy, and confidence in their daily activities. But treatment doesn't stop at antibiotics alone. Supportive care is just as important in managing Lyme disease. Especially for older adults, this may include rest, physical therapy to rebuild strength and flexibility, and medications to ease symptoms like inflammation and nerve pain. Personalized care plans, guided by regular consultations with healthcare providers, ensure the best possible outcomes and help prevent complications. Unfortunately, when Lyme disease is diagnosed late, the bacteria may have already spread, causing chronic symptoms that can linger for months or even years. This can lead to persistent joint swelling, debilitating fatigue, and neurological problems that significantly diminish quality of life. Many seniors I've spoken with shared how this delay made their recovery much harder and longer than expected, underscoring the critical need for awareness and timely medical intervention. Early detection is not just a recommendation, it's a necessity that can make the difference between a quick recovery and long-term struggle. With a solid understanding of treatment and its importance, let's move on to practical tips and lifestyle habits seniors can adopt to stay vigilant and protect themselves against Lyme disease in the future. One story that deeply resonated with me involves a close friend who embodies the spirit of many seniors: active, outdoorsy, and full of life, yet unaware of the silent threat that ticks can pose. She began feeling unusually tired and noticed persistent aches in her joints that didn't seem typical for her age. Along with these symptoms came a strange tingling sensation in her legs, something she initially dismissed as just part of growing older. It wasn't until she saw a faint, circular rash, a classic but often overlooked sign of Lyme disease, that she decided to seek medical advice. Unfortunately, the delay in recognizing the illness meant the bacteria had already spread, leading to a more complicated and prolonged treatment process. What stood out most was her resilience and the crucial role that heightened awareness played once she was diagnosed. With the right course of antibiotics, plenty of rest, and a gentle physical therapy regimen tailored to her needs, she slowly reclaimed her strength and regained confidence in her mobility. Her journey is a heartfelt reminder that paying attention to your body's signals and acting quickly can change the course of this disease dramatically. This personal experience reinforces the importance of staying informed and vigilant, especially if you love spending time in nature. Now, let's explore some practical strategies you can adopt to protect yourself and enjoy the outdoors safely, without fear of Lyme disease. As we come to the close of this video, I want you to carry with you the vital understanding that Lyme disease is a hidden danger that especially affects seniors, but it's one you can face head-on with knowledge and action. Recognizing the early signs, like that telltale rash, ongoing fatigue, and unexplained joint pain, is your first line of defense. These symptoms may seem subtle or easy to dismiss, but catching them early can make all the difference between a swift recovery and a prolonged health struggle. Prevention, too, is well within your reach. Simple habits like dressing appropriately when outdoors, thoroughly checking your body after spending time in nature, and maintaining a clean, tick-free environment can dramatically reduce your risk. I encourage you to be proactive. Don't wait for symptoms to worsen or assume it's just part of aging. Your health and independence are worth protecting. If this video has opened your eyes or empowered you in any way, please take a moment to share your thoughts and experiences in the comments below. Your story might help others recognize the signs earlier and seek timely help. Remember to like this video, share it with friends and family, and subscribe to Elderly Wisdom Secrets for trusted, practical health advice designed specifically for seniors. Together, we can create a community that supports one another in living safer, healthier, and more vibrant lives. Stay aware, stay prepared, and let's continue this journey toward wellness, because every day is an opportunity to take charge of your health and enjoy life to its fullest.